The measles vaccine is actually a very effective vaccine. If you look at people that have gotten 2 doses of the vaccine, they're 97% protected. 1 dose is about 90% protected. So getting vaccinated is probably the most important thing you can do to prevent yourself or others around you from getting measles. And so there's a couple things to think about in terms of how you can see, have I been vaccinated or not? First, anyone that's been born before 1957 is considered immune because measles was so common back then that pretty much everybody got infected. If you weren't born before 1957, you can look at things such as family records, looking at old pediatric records to see if you received the vaccine. Also, your healthcare provider may have those records. The other way to do this is there are some of the states, such as Nebraska, has a immunization database that if you were born in Nebraska and grew up there, you may be able to ask them to see if you have those records, if other ways of looking for them aren't available. There is one group of people that if you received the vaccine between 1963 and 1967, there was a brand of the vaccine on the market at that time that we later found out wasn't as effective. So if you received that vaccination during that time period, you may want to check with your healthcare provider because that may be a situation where you may want to get revaccinated.